Let's take a look at Kamala Harris. She's had an amazing political career from being District Attorney of San Francisco, Attorney General of California, Senator from California, Vice President of the United States, and now presidential candidate. We're going to explore whether or not she's had any potential facial plastic surgery over this period of time. Here we see Kamala Harris at age 39 in the beginning of her political career. And what we're looking at is a beautiful young woman with an oval-shaped face. The distance between her hairline and her eyebrows seem to be a little extended in terms of proportion of her vertical proportions of her face. But overall, a very bright, energetic young woman. Now, her skin tone tells us a little bit about her background because her father was a black Jamaican economist at Stanford. Her mother was an immigrant from India. And so she has this combined ethnicity, and we can see that in many of her features. Specifically, her skin tone, again, has this brown tone to it, which, of course, is this combined ethnicity. Her nose specifically has a kind of a flat nasal bridge, a flaring of her nostrils, and this kind of a V-shaped outline to her nose indicates a black origin. Now, her lips, she has very well-defined vermilion border and Cupid's bow. She has good tooth show of her upper lip. Overall, she is a beautiful young woman. And here we see Kamala Harris standing next to her mother 4 years later. Again, her skin tone is very similar to her mother's, who is of Indian descent. Here's Kamala at 2010, and she has some fine horizontal lines that traverse across her forehead and some heaviness of the glabellar region here due to the muscles contracting in this region. Now, of course, lines are normal in your mid-40s. This is nothing abnormal. She does have this lateral crowding, which she's had since she's a young woman, and some of that can be remedied by injecting Botox, believe it or not, in here, which are the depressor muscles, and out here where the lateral orbicularis muscles are. And by doing that, it can counteract the downward pull of these muscles and allow the brow to ascend upward. In addition, she should not have an injection right here in the middle of her forehead because that would sometimes cause the brow to descend downward and give her an induced brow ptosis. Here we see Kamala Harris at age 54, and she's now a U.S. Senator from California. And what we see in this oblique view is that her jawline contour is changed quite a bit. She has a jowl which is formed, causing a little bump below her jawline contour, and she has enlargement of the submandibular glands, which are the salivary glands underneath at the neck, and there's some laxity of the muscle and skin on her neck, which is causing her neck to have some wrinkles and folds. The other thing I want to point out is that she has this downward descent of her midface soft tissue and accentuation of these folds and depressions under her eyes. And that occurs, of course, with age. Like everything else, gravity pulls everything down. There's a change in the bony contours underneath which support the soft tissue, and there's some atrophy of tissue that occurs, of course, with age. So here we see Kamala as a Vice President of the United States, and you really can't see what's going on with her neck anymore, or the fact that she has jowls. It probably was photoshopped, this picture, because it looks too perfect. It doesn't look like she has a flaw anywhere on her face, which of course was shown in the previous picture 3 years prior to this. So it looks like a younger version of herself. So here we see a picture 1 year later, and of course this picture was not photoshopped. You can see clearly that her, starting from the top, she has much deeper horizontal lines on her forehead. She has a further lateral descent of her brows, which is encroaching on her eyelid creases. Her lower lids look a little bit hollow. There's a kind of a loss of fat or descent of the fat, and she has her cheeks are starting to descend. Her jowls have gotten worse. There's greater laxity of her neck, and her horizontal lines on her neck are also looking more prominent. So if Kamala Harris had the inclination to have plastic surgery, and that of course is a personal decision on her part, I would have recommended first I would have recommended a brow lift to raise these temporal drift and smooth out her forehead. Probably I would have considered doing a gliding brow lift because her hairline is quite a bit distant from her eyebrow to her hairline is long, and therefore I didn't want to recess her hairline posteriorly. I would have done what's called a gliding brow lift in preference to an endoscopic brow lift. In addition, her upper eyelid would require a blepharoplasty, which is to remove some skin and maybe a little protruding fat. And moving down to her lower eyelid, she has some hollowing in this region with deep tear troughs, and I would recommend a lower lid blepharoplasty with fat grafting to the lower lid. The fat would be obtained from, say, her belly, from her hip, and actually transferred to the lower lid. In regard to her face, her mid-face is descending downward, and her jawline is poorly defined. I would say that she's a candidate for a full facelift, and that would raise everything vertically upward. And she also has some prominence of these submandibular glands. Those submandibular glands can be reduced partially by removing a portion of those glands without causing secondary problems in terms of having moisture in your mouth. They usually do not cause any secondary functional problems there. And the neck muscles would also have to be tightened centrally and then lifted laterally and vertically to raise the face upward and give new definition to the jawline. Here's 2024, and a more recent picture. Again, we're looking at her neck and the laxity of her neck as well as the prominence of those glands. Now, she as a candidate has to project youth because obviously Biden is projecting old age. And she's in a real bind because she can't really take the time or the effort to have plastic surgery if she was inclined to, because she is obviously in the spotlight and doesn't have the time to recover. When you have these procedures, it takes weeks to months before you can recover fully. So obviously she's not a person who has the luxury of having that time to recover and project maybe the youthful image that she'd like to. So my analysis is that Kamala Harris has had 0 plastic surgery, and it appears that she's probably had no injections either. That's her personal choice, and that's okay. If you have any further questions, please leave them below. I'm more than happy to respond, and I look forward to seeing you in my next video.